I want to talk about what is a public health district. Who are those people in the district? What do they do? Where are they located? And why do we have districts in our structure? So when we think about what public health does to improve health in the communities, we're trying to use these three words, inform, prevent, and safeguard. And you can take anything that public health does. For example, let's think about flu, influenza, seasonal flu. Public health informs the public about the importance of getting their annual flu shots. You do that in all your counties. We prevent by administering the flu vaccine. That might be in the county health department, in the school-based clinics, and other settings, businesses in the community, a variety of places where public health administers flu vaccine. And then safeguard. That's the thing that you don't see maybe as visible. It's behind the scenes, the epidemiologists who are monitoring and tracking the rates of influenza and the patterns of influenza across the state, as well as, of course, your district, but also globally, and having that connection with CDC and looking at the global picture of influenza. So those are some things that we think about when we think about public health. Now, as far as the components of what we call our Georgia Public Health governmental entities, we'll start at the top, the county boards of health, a critical part of the entire infrastructure of public health in Georgia. Going around to the right, the district health directors, who also serve, as you know, as the chief executive officer for each of the county boards of health in their jurisdiction. They wear many hats. We have the state office public health staff, like myself and others. We have the county board of health staff, the nurses and the epidemiologists and the environmentalists and all the support staff who work for each county board of health. We have a Department of Public Health Board, which Dr. Fitzgerald works with and meets with monthly. And then in the center you'll see the department commissioner, Dr. Fitzgerald. So those are all the pieces of our governmental public health. That is not to say we also have a wide range of community partners, stakeholders, from the public sector, our private sector, as well as our federal partners. So a little bit of history. 2014 will be the 100th anniversary of the Ellis Health Law, which created the framework for county boards of health and districts in Georgia. Now, as far as the first district that was formed, it was formed in 1924, and it was formed over in the southwest corner of the state with Decatur, Seminole, and Miller counties. It later grew to, of course, become the Southwest District, District 8-2, but that was the first district in Georgia. The authority to establish districts in public health in Georgia, it's in the Georgia Code, Chapter 31-3-15. It authorizes the Department of Public Health, with the approval of the county boards of health and the county authorities in that area, to establish districts comprised of one or more counties. Now in Georgia we're very proud and very excited about all of the 18 public health districts that we have. We have 3 districts that are single county districts. Those are all located in the metro Atlanta area, Clayton, DeKalb, and Fulton. And then we have counties that have as many as 16 counties. District 7, Columbus District, and District 9-2, each have 16 counties. This org chart is what we call our photo org chart, showing all of the district health directors and all of the members of the commissioner's executive leadership team. So all of the district health directors report to and work with Dr. Fitzgerald, our department commissioner. And then she also has an executive leadership team on the left side of the chart. I'm on that executive leadership team, and my role is essentially in working with the districts. I'm the district liaison, so I advocate for issues in the districts, and I'm the commissioner's liaison between the commissioner's office and the districts. Work very closely with the district health directors. We have monthly meetings, we have a district health director council, we have a lot of different ways that we communicate with and advocate for issues within the district. And also recruitment of new future health directors to the state. I help coordinate that process. Now, as far as how many people are in governmental public health staff right now, we have a little over 5,500 county employees who work for the County Board of Health. So those are all located in the county health departments. Each of the 18 districts, we have around a little over 300 people, and we'll be talking about them in a minute. At the state office, we have a little over 700 people, and some of those state-paid employees actually are working in the counties. For example, there may be a nurse practitioner who's paid by the state, like for family planning, but is assigned and actually is working in a county health department. So there's about a little over 100 of those. So totally, we have a little over 6,500 public health staff working either at the state, district, or county level. When you add that to the important role that the county boards of health members play, which is 1,113 if you multiply 159 counties times 7, then you end up with over 7,672 people. Our district health directors, like I said, we have 18 district health directors. There's one at each district, and by law they must be a licensed physician in Georgia. They're licensed by the Georgia Composite Medical Board, and they have a variety of backgrounds. Some are pediatricians, some have an OBGYN background, internal medicine, family practice. We also have psychiatry as one of the background. The district health director has many different roles. First of all, they serve as the chief executive officer for each county board of health within the respective district. They manage and direct the district staff as well as the county health department staff. So they do the hiring and the supervision, the day-to-day oversight of operations of the health department. They spend a lot of time fostering and promoting community partnerships. The boards of health bring to the table ideas for those partnerships, and it's the health director who really makes those contacts and fosters and nurtures those relationships because they are so important to the work of public health. The health director also oversees all the public health budgets. The county boards of health approve the budgets. The district health director, though, is in charge of managing and the oversight and the day-to-day review of how we're doing with budgets. And then, of course, the district health director does report to and works closely with the Dr. Fitzgerald, our commissioner. Okay, so what is a public health district? I call it the administrative hub for the infrastructure of directing, supervising, and supporting local public health day-to-day operations. The health districts are the link between the county boards of health and the state. The state works with county boards of health, but through the districts, and specifically through the district health director. It just makes it a smoother kind of process for how we operate instead of working directly with each of the 159 counties. Okay, here are some key functions that districts perform. It's the district that looks out for the big picture and looks at the role of public health, what the changes might be, what the opportunities might be in setting policy and strategic direction. So developing that strategic plan is a big part of what the health director is in charge of. Also provides the administrative support for local public health. They also provide the administrative support for county boards of health as a CEO. For example, the county boards of health, for the most part, meet monthly. I think there's a few exceptions to that, but that's the regular schedule for meetings is monthly. So the preparation of those meetings, making sure that the information that needs to be shared with the county boards of health is prepared and ready, and the whole management and planning of those meetings is organized and supported at the district level. And then the next function is just the day-to-day county health department operations. Whereas the county boards of health are very much a part of being informed of those operations and advocating for public health, the day-to-day operations is left up to the district health director to have staff, either he or she directly manages or works with his staff to see that the county is supported with what they need to keep the lights on and to keep the services open, to make sure the public is aware of what the services are, all those kinds of things. Staffing, recruiting, all of that is handled by the district. Then there are some specialized services that are district-wide. Key important role of the district is to serve as that link between the County Board of Health and the state. There's lots of resources at our state office under Dr. Fitzgerald's direction. Those resources are available to each district and each county. being channeled through the district health director. Here are some examples of those administrative services that are provided by the district. Personnel, the recruiting, the hiring, working on employee retention, all those activities are managed at the district office. Payroll, leave, benefits, all the keeping up of personnel files, setting policies, state and federal regulations, managing any disciplinary process that has to be addressed, and being that liaison. There's a HR representative at each district, and so they keep informed of all of the personnel rules and if there's changes, and then they pass those on to everybody in the county. So there's a coordinated effort in that regards. It would be cost prohibitive for every single county to have to provide all of these services. So it does save, it supports each county, but it also saves on resources, and that's very important right now when we're all faced with budget cuts and making sure that we're making the best use of the resources. Some more examples of administrative services are in the financial area. The district is responsible for preparing and managing the budget, managing that fiscal audit that's required, all the cost accounting activities, and the follow-up to those audit findings, if there are any that need follow-up. Those are managed at the district level. They prepare all the financial and all the cost reports that are required, all the daily administrative operations, procurement, all the purchasing, the accounts payable, all that is handled at the district level. They make sure that they're in compliance with federal, state, and the Department of Public Health regulations, all of our policies. We have the master agreement to give out the grant and aid funds to each county, so the district manages and make sure that we're reporting what needs to be reported in accordance with the requirements of those master agreements. All that is done at the district level. Some districts have centralized billing. Some are in the process of looking at centralized billing. If they don't have centralized billing, then they're giving guidance to counties about the billing coding and the standards that they should be using to be consistent with billing. Okay, another area of administrative support to the counties that the district provides is in the area of IT. So the district has an IT person, Management Information System Director. Each district has one of those, and so they keep up with any new employees that need a login account. They manage those. They assure that we're in compliance with the HIPAA security compliance requirements. They make sure that we're submitting the revenue maximization data that's required for reimbursement of admin claiming. And they maintain all the hardware and keep it all functioning. So if there's any server down or any issue there, they're the ones that problem solve and keep the system working for the district. Very important to our day-to-day business. And then last, there's a liaison, just like personnel. There's a liaison. The MIS director is the liaison to the state for any IT issues that we're developing on a statewide basis. So we are looking at systems that can talk to each other and make the best use of providing us the data that we need. Each district has an epidemiologist. They have at least one. Some have more than one. But you won't find an epidemiologist in every single county because it would be too cost prohibitive. If there's a TB case investigation that has to be done in the schools, the epidemiologist is very much there, as well as the rest of the team, the nurses and all of the staff, the administrative support staff. If it's in a school, then they go to the school, they do the screening at the school site or wherever they need to do it. Emergency preparedness. There's a lot that goes on at the district level. So there, for example, there's an emergency coordinator at each district who coordinates activities with all of the counties within that district's jurisdiction. School-based flu projects are coordinated under the direction of the district health director. Another item on this list is the review and approval of nurse protocols. Now, some other specialized services that are available at each district are environmental health. There's one district epidemiologist. There's for nursing, there's one nursing director at each district. Nutrition, each district has a nutritionist. Public information, there's a public information officer within each district. Emergency preparedness is a huge part of what public health does. And then quality improvement. So why do we have a district structure? Why do we have the 18 districts in Georgia? Well, first of all, it's cost saving, prevent duplication, and again to make the best use of all the resources that we have. And it's so important right now, especially as we deal with budget cuts at all levels. We have to make the best use of all the resources within our system, at the county, at the state, and district level.